watching us. And this will be recorded. It's recorded as well, so you can go back and watch it. And please note, we will be emailing these slides out. For those who aren't aware, this was supposed to be the bone met session. Fortunately, the speaker is ill, is unable to attend. Brain. My brain has gone off somewhere else right now. So this is supposed to be the brain met session. We will talk a little bit about brain mets because Elaine has had brain mets herself, and I can talk a little bit about the advocacy around brain mets just briefly. But that'll be picked up as a webinar in the next month. So we do apologize for that inconvenience. You're now stuck with I'm Josh, and this is Elaine. You're stuck with us for an hour or so before we have some wine. And before those online go and do something else with their day. So one of the things that we wanted to talk about at this conference is advocacy and then resources, because I think, as you saw from Dr. Tripathi's talk, there's a lot of progress happening, and trying to navigate all that and make sense of that it's just insane. And it's insane for patients, most importantly. It's insane for physicians, researchers, anyone in this space. It's crazy. And so trying to figure out a way to navigate that, and really the way to do that is that creating that sense of community. And you've heard me say that several times today, and it's said a lot, is that we really have to create that sense of community. And that word means something different for everybody. It could be your significant other, it could be your sister, it could be a brother, a friend, or another patient even. Maybe you're living in a different part of the country from family, but really trying to find some sense of community. I think Gail's story of sharing about what they were able to do at MD Anderson to now start that program, that was started by patients, that was started by advocates. Dr. Tripathi would be the first person to tell you that. And so I think it's really important to understand that your voice really does matter, and you really can make a difference. So I'm just going to run through a few quick slides, and then we're just going to have a chat. Online, I don't think we have a way to set up Q&A, but if you have questions, you can always email us, and I can respond at a later date. This is why I'm here. This was my mother, Teresa. She was diagnosed with metastatic back in 2010 and passed away in 2013. We started the foundation together that we have, Teresa's Research Foundation. It's focused on research, and we host a medical conference. And her belief really was about creating that sense of community, and that's why we started the foundation. We were big supporters of Komen, and I still am, as I'm here today. But we really wanted that sole focus on metastatic, because I think that's sometimes what people that aren't aware of, if you're not in the space, is you might understand, like, why is so-and-so doing this or doing that? Well, they're serving a larger constituent. And so what I'm a part of is I serve just metastatic. So it's just a little bit different. And so there's other groups that serve all breast cancer. There's groups that serve all cancer. There's there's different groups that serve all kind of advocacy for all kinds of different illnesses. And so I think that's an important thing to think about when you're getting into something, is to understand kind of where that group is coming from. And so one of the first things I want to talk about real quick is the MBC Alliance. And this is really something that I was really fortunate to get involved in from the ground floor. And again, same deal, kind of similar to what we were talking about before, is I just reached out and they said, heck yeah, come be a part of it. And then I asked to be on a committee, and they said, yeah. And the one thing I'll warn you about being on committees is once you ask, they keep asking you. So just be leery of that. I hear that a lot from advocates now, is like, okay, when do you need me for this? Because I don't want to overcommit to this, and this. But look at all of these different organizations. I mean, it's remarkable. And there are other nonprofits like MetaViver and MedUp and other groups that aren't a member of this, but are also doing great work in the metastatic space. And there's hospital systems like MD Anderson or Baylor College of Medicine or Methodist here in Houston, for example, that are doing stuff. But just to kind of point out, I mean, just for our organization alone, we work with Komen, YSC, Twisted Pink, Share. I've done stuff with them, Living Beyond Breast Cancer, NBCN, Metastasis Research Society, Force. Even if I haven't directly worked with them, I can probably tell you about them, BCRF. And so it's really created a sense of that community of working together. So though, yes, they're all out there raising funds and doing different things, we're more effective by being in a larger group. So it's a really great group that's doing some different things. And I encourage you that the most important thing to say about that is that they're in the process of updating their website. And as I mentioned, it's extremely complicated to navigate this system, right? Who do I go to for this? If I need to get insurance help, or if I want to do research, or where do I go? I could tell you like 1,000 different places to go, and that's not helpful. So the NBC Alliance has done something on their website where you can kind of click different things and it'll pull down the different organizations that offer those kinds of services. They also are in the process of updating the website to make it even easier. So I really encourage people to go to that website. And then one other quick thing, that's the link to the website, nbcalliance.org. And then one thing I encourage you to review, as you saw the talk with Dr. Tripathi, there's a lot of things going on. And so this is a really good primer to kind of give an idea of where we are and where we were actually, and where we might be going. Because this landscape analysis was published in October of 2014 to kind of say where we were at. Now we're in 2020. They're actually in the process of starting the conversation of doing a new analysis, but it really shows you where we are at in the field and kind of where we're going. I mean, I think Dr. Tripathi really painted quite the picture of progress. I mean, just since my mother has passed, the amount of drugs approved, it's unreal. And the other thing about that to note is that, so the drugs approved, Dr. Tripathi showed in a few of his talks. Now they're going back and studying those drugs that are approved and really finding the right patient to match to those drugs. So it's even getting that greater needle in the haystack. And so I think that's what I'm really hopeful about. Okay, so these are some slides that were put together by a lovely patient advocate by the name of Joan Mancuso a few years ago. They need to be updated a bit, but it'll kind of get you going. And these are just kind of different questions. These are some resources that you can find. I don't want to go spend too much time because I really want to have more of a discussion. Living Beyond Breast Cancer, Metastatic Breast Cancer Network, Novartis has tools. So that's the other thing. A lot of the pharmaceutical companies who are supporting today, they have resources as well. Helpline. So I mentioned again about maybe being isolated. Maybe you don't have that support network right in your community, depending on where you're located, or different challenges, side effects you might be going on with. There's a lot of helplines now. So Share is really one of the first ones. Komen has some. They even have one now for clinical trials to help navigate that. So super excited about that. YSC, so Young Survival Coalition, has some really good stuff. Living Beyond Breast Cancer. So you can kind of see the different areas there. And then finding an in-person group. So if you want to have more of a personal time, so we mentioned the MD Anderson group. To note on that as well, you don't have to be a patient of MD Anderson to attend their support group. So I think that's a really important thing to note. There's different helplines. Again, I mean, there's just so many different things. Metaviver has a good peer-to-peer support group. Cancer support community. They don't have, we don't have that here, but they do have resources around the U.S. and online. And then, of course, American Cancer Society. Again, an example of a group that's serving all cancers, but they definitely have services in breast cancer and specific to metastatic. Telephone groups, and we kind of mentioned those already. Oh, okay, look at this one. I mean, this is just, I mean, Joan, and so this is, again, imagine, this is an advocate who put this together. This is a patient. Who put this together, and in years, she's been living for a very long time with metastatic, and she's amazing. But look at all these different resources. How would you even expect your nurse to know about all of those? How would you as a patient expect to know about all those? So you can see how it can become quite daunting to really try to figure out a road to understand this. So I wanted to talk a little bit about again, advocacy. So I kind of did resources, but if you're interested in, and I think that'll be where we can kind of talk more about that dialogue, because I can maybe answer more questions individually about where you might want to go or what you're trying to achieve. But Komen has a Komen Advocate in Science, which I'm a member of, and it's a really great resource to join. It's free, and they take most people are accepted into it. And there will be a poster here tomorrow that kind of highlights more the Advocates in Science group. And it's a really good group, and just being on that listserv again is super helpful, because it doesn't capture everything that's going on in the field, but it's at least a little bit, a little more kind of organized in a way that you get monthly, that you can kind of say, oh, okay, wow, that's happening, or that did happen. I want to get involved in it. And then they also have a lot of different, I mentioned the webinar that's going to be happening with Brain Mets. There's also some other webinars that they have around advocacy, and they're just doing some really good work in this space. Okay, so here's a fun one. So this is conferences with advocates and travel scholarships. So did anyone in the room today get a travel scholarship to attend here? Okay, I think everyone here is local. So there was a few people here that attended this conference with a travel scholarship. There are a ton of different abilities to attend conferences around the United States and abroad. And it's just, again, trying to find that needle in the haystack. How do you navigate that? Where do you start? One of the places that I'll get to in a second, I'll show you how to find some of it. But San Antonio, so that's, you can go to this link here. Again, I'll be sending these out. This is the world's largest breast cancer conference. They have an advocacy program, and they also have a program now called GRASP that helps navigate people through the poster session and create partnerships with researchers. Metastaticbreast.org, shameless plug on my end. That's the medical conference that I host. That's the sole thing that our foundation does, is we host a medical conference solely for metastatic. It's now in its 7th year. This year will be in Salt Lake City, September 10th and 11th. ASCO, which is the American Society of Clinical Oncology, again, has a patient advocate program at their annual conference in Chicago. There's scholarships available. AACR has a scientist survivor program. It's much more in depth, but a very good program. This year's conference will be in San Diego. Another one that's not on here that's coming up in April, Living Beyond Breast Cancer, has a patient conference every year in Philadelphia. It's one of the largest running patient conferences. The cool thing about that one is that it's a lot of people from all over the United States. Whereas the Komen conferences are amazing because they're building a community here, but they're more usually regionally or local based. So just a few more resources. So clinical trials, Dr. Tripathi talked about that as well, and we're going to talk about that tomorrow with Dr. Ellis a little bit. So there's 2 resources that, again, this is, again, that the power in numbers. Part of the Metastatic Alliance, there's a group called breastcancertrials.org, and they started a metastatic breast cancer trial search. And they have now also understanding clinical trials is so complex. They've started a metastatic trial talk to help improve education and awareness about the disease. And you can go to our website. So I put the link to our website, Teresa's Research. You can go to Susan G. Komen's website. You can go directly to breastcancertrials.org. And a lot of the different partners have it on their site. So again, it's an example of how we are actually working together. So again, going back to, I mentioned Joan, I wanted to share a couple of resources from, these are actual patients living with metastatic breast cancer who have dedicated their life to giving back to their friends, other patients living with this disease. And so this is Christine Hodgen, who is amazing. And she has a website called Storm Writers. This is her on the right. And she's all about a sense of community, so she's really big into making sure that minorities are included. And she has a good friend, her name's Julia, who also, they're usually in tandem working together. And they've only been doing this a few years. So I also don't want you to think this hasn't been going on like 10 years. Like this is a short amount of time. But they have a group, a website called stormwriters.org. And what's cool about it is that, so you can't go to a conference, you can go there, and they put meeting reports up. And it's directly from a patient. So you don't necessarily get lost in the weeds when you have someone as brilliant as Dr. Tripathi talking, and it might seem like it's over your head. They put it in more layman's terms so you can kind of understand it, and it's a good way to go back. This is another thing I really want to add that's really important, and I think this is where the space is changing so much, is this Facebook group. So it's a Facebook group that she also runs. It's called NBC Trials and Innovative Treatments. And this is the link to it. And again, we'll send this out. But this has been a game changer for advocacy because it's really a way to connect with one another. And I'm so honored to be a part of this group. There's a few that I'm a part of, but there's way more that people are members of. And these groups are really a great way to connect with other patients. But it's an even better way to hear about the latest treatments. And again, you're hearing it from other patients, other advocates that are working in the space, and they're pumping out papers. They're going to tell you if something's crap or not, because I think that's a lot of times you see something where it's like, oh, it cured cancer in a mouse, and then they'll be like, no, no, no. So these closed groups, this is one group, but you can kind of search NBC trials and find that on Facebook and join. Sometimes some of these groups will ask a few questions. Some are more are patient only. Some are only those that are involved in the space, and some are open to kind of the public as a whole, because that's really what we want. Is we really want to educate everyone about this. And so the groups are varying, and I highly recommend them. This is another patient-focused one that I'm just so in awe of. So this is Ann Lozer, a metastatic breast cancer patient, has been living for a very long time. She's in Utah, and she decided that, gosh, I'm going to write a whole entire book about metastatic breast cancer, and then I'm going to actually update it all the time. So this is, again, if you're not able to go to every conference, because there's so many, you can actually go to this website. It's insidersguidembc.com. You can even find it on Amazon, and you can download it. It's free. And she's updating it. So there's, like, for example, now if you go to the website, there's an update from when she attended San Antonio. So it's really helpful, because this is someone that's a really highly skilled, trained advocate that knows so much about the science, and she's directly involved. Okay, that's all the slides I had. So I just kind of went through a whirlwind there, and I'm going to quiz you on all of it. I'm not, I promise. Oh, on your Kindle. Look at that. I love it. I mean, that's just kind of an example of being able to access that, and kind of a good thing. Like, if you want to, like, go back and check something, you can kind of use that as a guide. And I think what's neat about that and the storm writers, and there's other advocates out there that do that. I'm not. There's so many that I'm missing that deserve credit to be mentioned. But that's just an example of advocacy from that point of view. But there's really all kinds of different sides. Elaine, would you like to maybe add a little bit about your experiences of being an advocate briefly, and then I think we can open it up to questions.
Okay, thank you, Josh, and thank you, guys in the audience. Um, started when I became metastatic. I really wasn't out there when I was first diagnosed, and that was in 2008. In 2015, that was my third diagnosis, and going to different conferences, meeting different people that have the same diagnosis helped me a lot. And bringing back information to the community, giving information out there. And that's where I'm at on sharing my journey. I like to share that so people know that they're not alone. Whatever you're going through, you're not alone. Thank you.
Oh, that was wonderful. Thank you.
Thank
Um, I think it's about building relationships. We've known each other now for what, 3 or 4 years
you.
now?
Yes.
Yeah.
Yes.
So I think,
Awesome.
yeah, I mean, so I think that's also what it's about. Again, creating that sense of community. I do want to just add a couple things real quick on the brain mets, in case there's someone on here who's like, why am I not hearing about brain mets, and why am I listening to this guy ramble? I really encourage people when that webinar comes out to check it out, even if you don't have brain mets, because there's going to be a lot of really good information about there, and it's also a good guide on about advocacy and about where it's going. So because patients are living longer, and because advocates have now started to speak up, there's a lot of work that are being done by advocates um, to make sure that clinical trials include people with brain mets. It's huge. And so there's a recent drug approval. They included that. And then the FDA is really working. There's a wonderful doctor there, Dr. Tatiana Prowl, who's doing a lot of work, and her colleagues around that. And so that's the other kind of thing I really want people to understand, is that there really is a lot of people out there working for you. I think a lot of times people think, oh, this person or that or this. Like, no, there's one enemy. It's cancer. That's it. Like, there's no one, and that comes from a researcher that I work with by Danny Welch. Him and I have known each other for a long time, and he's done Mets research at the University of Kansas. And we were talking one day, and he's just like, at the end of the day, there's one enemy, and that's the cancer. And so there's a lot of people out there working, and so they're really pushing on brain mets. And so I think that webinar is going to be really phenomenal to check out because they're doing some great work at MD Anderson, and then there's some good work coming out of Dana Farber around brain mets as well from the team up there. And the MBC Alliance is working with its patients because there's multiple task force and now patients are involved in that that are helping push that movement as well. So it's really important. So with that, I kind of want to open it up to questions. Let's just have a little hangout for a little bit. So anyone? You can use the mic if you don't, or you don't have to.
As I said, as I said earlier, I was curious, number one, for myself, because I didn't have anyone with metastatic that I was aware of. So I did my own little research and I said, hey, wait a minute, need more information. So, like I said, 2015 was my first diagnosis, my third diagnosis, but my first diagnosis was metastatic, and that was in the lung. And then the fourth diagnosis was in 2017 in the brain, and I'm still going on with that. So, yeah. Okay, I have the whole brain and the gamma knife, but no medication and I had surgery. Can't forget that one. I had a great surgeon though. And when I got out of surgery, people would come to the hospital. You don't look sick. No, I'm not sick. She did a great job. And when I got out, I wasn't off balance. But recently, I got off balance. And we're going to do an MRI on the 18th. And from that MRI, we'll go see where we're going to move forward. Hopefully and prayerfully, there's no more lesions in the brain, and I'm doing physical therapy. So hopefully, yes. And I'm waiting if there's any more lesions in the brain, we're going to discuss one of the clinical trial that was approved. And when we was in San Antonio, they announced that, and they had a good report on that particular drug. And so if necessary, I'm looking forward to be on that so I can get rid of being with this brain stuff. Yes.
That's good. So I think that's another example of advocacy, right? So there's kind of two forms, right? So there's advocating for yourself, which is the first and foremost, because if you can't advocate for yourself, then you're not going to be able to advocate for others. And so I think Elaine's a really good example. You know, she was at San Antonio this year and was able to attend some sessions and see that, wow, and then she can take that back to her doctor. But then now she's taking that and advocating it out to the greater audience, what she's able to learn. So I think that's also kind of an interesting thing to think about. You know, that's twofold to really speak up. So, any more questions? Yeah. Hodgin, yeah. Yes. Yeah, Julia Mouse, yeah. Mhm. 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 Right. Absolutely. And I think there's kind of two sides to that, right? So I think there's one is that like, not everyone has those altruistic intentions. So I think that's the one thing that is also important is to know that like they have professional backgrounds and then they, with the diagnosis weren't able to work anymore. And then after kind of getting like all stable, or I hate that word. I was going to say like, feeling well enough to get out there, perhaps, right? Feeling well enough to get out there. You know how many people on that board fatigue? I mean, I don't have cancer and I'm tired, so I can only imagine living with it how tired you must be all the time, and then I just can't even imagine. And so I think that's one thing to say though is that yes, there are certain people that are out there, but it's kind of you have to then kind of take your filter, right? It's just like anything, right? The news, right? Anything out there in the world, you also have to kind of then take your own filter and kind of say, I don't know about that, or yeah, I really want to learn more about that. And so I think that is one thing that I always say, if someone was newly diagnosed, the first thing I would do is take their computer or phone away from them, just so they can just take time to process it, take care of themselves for just a little bit, reach out to some friends, talk to their doctor, because there's so much noise out there. And then you're just, if you start, and that's one thing that, with, for example, with our medical conference is very, very highly level didactic science. A lot of doctors don't even understand some of what's being discussed there. So someone that was just diagnosed a few months ago, we wouldn't want them to attend that conference per se, because it's just gonna overwhelm them, and it's gonna do more harm than good. So that's why we want you to come to. That's why we actually partner. That's why the foundation partners with this conference, because we want people to get kind of a primer at programs like this, and there's training out there that you can get through groups like National Breast Cancer Foundation, um, then and Project Lead, and different things. But I think that is one thing. It's a good point that there are kind of these influencers and people out there, but it's a complicated world, like every topic, right?
I want to add something to that. When you say reach out to your family and friends, I would suggest that that's good also, but reach out to someone that's going through what you're going through, have been through, and you can get some real good advice, because somebody that haven't walked in your shoe may not be able to give you the advice that you need. So I would suggest that. And we have so many support groups um, that can help you through the process. That's all I wanted to add to that.
Oh no, that was great. I mean, I think that's exactly true. Is that when my mom was alive, she probably knew, I don't know, maybe a dozen patients, and now, I mean, how many other patients
Oh
do you
my.
think you know? Hundreds, right?
Yes,
So
yes,
Elaine
yes.
just said, hundreds, and so I think that that's really important, because even a physician who treats the disease, or me as a former caregiver, I still don't really understand it, right? Because I'm not living with it. And so I think that is important to find that community. But then the other flip side of that that's happening right now is that more people are connecting. And though there is great progress happening, we're still losing way too many people to this disease every day. And so that is, of course, having a great impact on patients and on advocates as well. And we're actually going to touch on that tomorrow morning a little bit. We won't go into that right now. But so I think that's another thing to think about as well. So, yeah. I know we got more questions. Yeah. Oh, like the terminology. Yeah, that's a really good question. So that was one thing they put in the bags today, and I think hopefully I'll try to talk to Jenny about sending that online. They're going to send out a glossary of terms. You can go. I mean, so this is again about where you get care, right? And this is another issue. So a lot of times they'll have a glossary of terms when you're newly diagnosed, but you can also go on like the NIH website, or the NCI, the National Institute of Health and the National Cancer Institute have a glossary of terms that can help you. But not everyone is. I mean, that takes a lot to get to that point, right? And so I think that's why it's so important to try to um, get connected either with another patient, like Elaine said, or get connected. Hopefully, the place that you're getting care has a social worker, or at a minimum, a nurse navigator, because they usually will have some of those resources, or they can connect you to nonprofits like Komen, or others that can help you find that. But I think that's a really good question, because not everyone has those resources, or what if that practice or whatever is busy that day? They may forget to put that insert in. Um, but the biggest thing is, I would say, is that if you're not sure about something, ask. It's your life. We get one life. We get one chance at this. So no question is stupid. No question is inappropriate. Ask it, because it's your life. That's a big thing that we really push. A second opinion, and speaking up, and again, going back to that advocacy for yourself, right? So there's kind of that two prong. You almost got to do the first one before you can do the second one. Um, yeah. Yeah. Mm. Yes.
Yes. I am a patient. I'm okay with that. Yes. Ooh, fatigue was number one. I just, as I said, the first go round with the chemo and everything, and also I'm HER2 positive, so I do 21-day cycle with Herceptin. Now Progetta is added to. But the fatigue, that was, I couldn't understand why am I so tired. I went through all this in my first and second diagnose, and the third diagnose, and the fourth diagnose with the brain, the fatigue with the whole brain radiation and the gamma knife, the fatigue. That I had the first go round I had, it was seven, and we did the whole brain, and there was two stubborn ones left, and then we came back and we did the gamma knife, and then it was only one, and then I wouldn't say that. I wouldn't say that. Well, my friends and everybody said, "You have a great memory." I said, "No, I don't. No, I don't. No, it's I sense." And we talk about chemo brain, but this is I sense, yes, memory loss. I forget where I put my keys. I forget. I It was my phone. Yesterday, I was looking all over my phone. I said, "I know that phone was there." But yes, no, like I said, when they did the operation on my brain, so people were very surprised how alert and everything. It was really truly blessed. Like I said, I had a great surgeon and the dear Lord, of course, and I have a lot of prayer warriors out there. So, but yes, I'm very, like I said, the only thing is that cane that we're gonna get rid of when we finish with the physical therapy. But other than I'm only on the Herceptin and Progetta and like I said, when we do that MRI on the 18th, I'll see my brain oncologist, and we'll go from there. And the announcement that they made in at San Antonio for the new drug, that if necessary, that I may need it, because my understanding of the brain, that blood is just not getting there with the other medicine to protect the brain. So I want something to protect the brain, so this stuff to stop and nothing continue to come back. Yeah. So that. Thank you.
And I think that the one thing that I would just add on to that is that I think it's also about each person's experience is so unique. I think one of the things is that it's so great because we've put different boxes into these different subtypes and things like that. But then it's like, oh, mine's the same as this person's and that. And what we're learning through all this technology is not. And each person's cancer and their experience is so unique. So I think that's kind of the other thing that's hard is like, which I'm kind of glad that we kind of did that with the sessions today, right? So we didn't do subtype, right? We just did liver and bone mats and lung mats, and then we were supposed to have brain mats because I think it's don't jump them into those subtypes because we want you to realize that your own experience is yours, and everyone is different, and so yeah. Question. Mm-hmm. Sure. So, um, right. Yeah, I think that's a right. So I think, well, first I would say you have to mix in some stuff in there for you too, right? So I think try to get some trips. I know, like for you, like going to see your daughter, things like that. So do some of those trips. Um, but I think it's also kind of figuring out what you're interested in. So, for example, going to the size of the conference. So our conference, for example, is about 250 people. So you're rubbing shoulders for 2 days with a Dr. Tripathi, with the smartest minds in the world. You go to San Antonio, or you're walking around with 8,000 people, you know, so it's just different. So it depends on what you're wanting. Some people want to just be kind of left alone and kind of go to their sessions. What's cool now is that they all have advocacy programs that provide funding. So like you could go to an ASCO is clinical based, and there are sessions, and they have what's cool is usually they have like an FDA session, and they have an advocacy lounge. So it's kind of depending on what you're interested in, right? So there's two folds of that. One is what kind of advocacy do you want to do? So do you want to do something maybe more treatment based? Um, and then, are you trying to look at stuff for you to figure out what treatment line might be next for you? Or are you trying to help others? So I think that's also the other key, because like Hear My Voice, through Living Beyond Breast Cancer, they have a training program at their patient conference. So that also might guide you in where you're going to go. Is that if you're trying to get training, that might kind of help you. Yes. Mm-hmm. Okay. Mm. Yep. Right. Yeah, so that was one of the ones that was, yeah. So yeah, so it's this one here on the bottom, and it's a survivor patient. That's what I would say to you is that, so this program has, as she mentioned, it has an assistance program. Like you don't just go there on your own, right? So that's what I would say is you can go to our conference and you can kind of just do your own thing. But you would, if you're going to go to AACR, you're going to want to probably have some partners in crime with you, or have a mentor of some kind. Kind of same deal with ASCO, because it's a lot of walking too. The nice thing about San Antonio, is it's a little bit smaller. As far as like you're walking, it's relatively all kind of in the same confined area. So that's a lot of times why a lot of even the physicians and researchers like it's a little easier to get around. So I think that's kind of the thing, is that, again, it goes back to, you got to kind of figure out what fits your interests, and then kind of from there you kind of map it out. I would recommend, before you go into a deep research conference, especially if you're trying to do advocacy work, to get some kind of training first. So whether it be the AACR program that she mentioned, or it be Project Lead, which is a training institute, or doing Hear My Voice through Living Beyond Breast Cancer. Komen is offering trainings, and I really recommend some of those. Most importantly, yes, you learn, but you get to meet other advocates, and so that's kind of a fun thing. Hmm. Yeah. Y- Um. Yeah. Well, I think she's talking more about the like actually. So yes, attending for a very long time, but now what's happening is advocates are actually integrated into they're integrated into the program. So like San Antonio this year had several sessions with actual advocates on the panels, and so that's now where we're starting to go. We have in all these breakouts today, there's a patient advocate helping with that. This conference is overseen by a patient living with MBC. That's a requirement to do it. We won't, Komen and us and Teresa's research won't do it without that, because you have to have that. And so that's where it's changing. The one thing I can add, like for example, our conference, because it's smaller, we give out about anywhere from 30 to 40 scholarships to attend. Elaine's been several times, and our conference, we have people on the planning committee that are patients living with MBC. So they're integrated into again, it's smaller, intimate. They're able to ask questions. What's more important about our conferences is that we have a welcome reception or a dinner where you're literally interacting with people, with other patients and doctors, and researchers. So I think that's also a little bit different. The Living Beyond Breast Cancer Conference in Philadelphia is great because there's a lot of senior vets like Elaine there, but then there's a lot of newly diagnosed patients that go to that conference. So it's a good mix where you can kind of really get some resources that are really important to you. So that's interesting. So you like are in my brain, which I love. So that is that kind of other arm of advocacy that we're going to talk a lot about tomorrow with my session with Dr. Ellis. And as I was talking to Dr. Tripathi out there, that was one thing that he talked to me about, is that he was just sharing, and he shared, of course, in his talk, how much he learns from his patients every day. And that is now where we're going. Okay, is that what I've been able to learn as an advocate is it's so remarkable what people have been able to learn with such little information. And now what's happening is there are projects out there where people are trying to study patients that are actually living with the disease. And so there's the NBC project, which is out there, which is great. Tomorrow, the program we're going to be talking about is NBC Connect, which is out of the NBC Alliance, and it's a project that myself and Dr. Ellis are involved in. There are other registries. As Dr. Tripathi mentioned today, you can donate your blood tissue. There's a project I'm working on at Baylor where we're trying to get bone samples. And so that's the bottom line. And that's like the whole, for our conference, that's the whole point from our planners, is that we aren't going to uncover, if you're really trying to actually cure the disease, we're not going to find it without working with you. It's just not going to happen. That's a fact. And so that's really where that's now we're transitioning to that. But of course, there's a lot of complexity to that, right? Because a bone biopsy is extremely painful. Going over, as Abby mentioned in her, she's trying to get a registry approved and is dealing with IRB issues. So there's a lot of regulation issues and challenges. And that's another opportunity as well. Like, I'm going all over the place, and you can see just, again, how hard this is to navigate, right? But one other thing I would leave you with is that I think partnering with your local academic institution is really a way to help you figure out how to navigate the system a little bit. Because sometimes it might be hard to do something you're trying to do, but partnering with one institution is a little bit easier, sometimes even more easier than a nonprofit. And so I think that's also an opportunity to kind of help you kind of figure that out. But yeah, there are, everyone's really fascinated by liquid biopsy. I believe you and I have talked about that before. You provide, that's wonderful. NBC project. Oh, wonderful. Yeah. So, I mean, I think that's a great asset. And, that data is now out and available, and people are able to access that. And, so, and researchers are. Exactly. And that's really the direction. So that's where NBC Connect, you can access the data now. We're starting to go back through that data and validate it. There's other projects out there too, where they're trying to, again, overcome a lot of those barriers in the academia to make that data more open. And that's, again, where advocates and patients living with this disease can really make a big impact as well, is speaking up. Because a lot of times, if I want to get something done, I'll just get Elaine involved, or I'll get another patient, because no one's going to, I mean, I'm not saying no to someone living with metastatic who's wanting to do something. And I can assure you that a lot of these institutions aren't either. They may be challenging some roadblocks, but when you're trying to advocate for this and do this, when you have a patient or an advocate at your side, you're going to be much more successful. And I think the other part of that too is that, kind of with my other hat on, is a lot of what I learn and do every day is because of my job. I work at Baylor College of Medicine, and I've been there for 5 years. And so I'm hanging out with 13 different labs focused on breast cancer. About at least 10 of those labs focus on metastatic breast cancer. So I get to learn from them every day. And what's so kind to them is they're like, oh, I get to learn from you, because I tell them, hey, I'm here. And Elaine is telling me about her side effects from, getting brain surgery. And I have this person out in the audience asking these really intellectual questions about, like, what are these side effects? And you take that back. And that's what happens, for example, at our conference, is like, that's the thing, is that people are just so blown away by the questions that you all ask. And I think that's what's so wonderful, is it creates this dialogue, right? Again, it's that, I know you're probably going to all like smack me upside the head if I say it one more time, but it's that sense of community. That's why we keep saying that. So yeah. Go ahead.
No, I said we won't slap you upside your head, because it is about the community, bringing everybody in.
Oh, that's good. Yeah. How are we on time? Do you know? Are we about done? I think 4:37. Man, see, we literally put that session together in like a 5 minutes this morning when we figured out there was a cancellation. That you can just see how much there is to talk about, right? I mean, we haven't even scratched the surface, right? Yes. Hmm. Yes. Yes. That's a really great one. And there's someone again online. You're like, why is he saying this? But it'll make sense to people in the room. Michelle Pena is here, and I can introduce you to her. She's the local kind of rep for YSC. She's a early stage survivor, and exactly that's another great resource. And there's an example of partnership. We did a session with them when they were in Austin last year on Metastatic. And Julia, who you mentioned, helped me run that session with a wonderful doctor over at MD Anderson. And so I think there are just a lot of resources out there. And I think my business cards are out on the table out there. So if you have advocacy questions, I'm happy to try to help navigate you. There's some other advocates in the room I can tell already that can help navigate you as well. And again, I thank you all for coming today and hanging out with us kind of last minute like this. It was fun. Yeah. Oh, the poster session. So at a lot of the larger medical conferences, they have poster sessions, especially AACR is a good example. And so what it is scientists take their data and it gets accepted into the conference, and all this data, like years and years of work, is on one poster, and they stand there for like 3 hours and they talk about the research. And so there's a program now called GRASP, and AACR does this as well. And there's some groups out of University of Kansas that are doing it, where they're partnering with advocates to kind of walk the poster sessions. It's just a way to get information not in a didactic form. So if you kind of notice, Elaine and I are sitting in front of the table with you. One of the things that's really starting to change is that we want to get away from these podiums. We want to get away from, these are barriers to community, right? And we don't want to, this is why I had like only 4 slides, because I don't want to sit and talk to you for an hour. You don't want to hear me talk for an hour. And you don't want to hear from these doctors talk for an hour. And they don't want to hear themselves talk for an hour. Exactly. And so you've got to create that sense of community. You got to get that dialogue going. I think there's so many different areas, we haven't even, for example, disparities. We haven't even touched that, right, in this discussion. And that's something where it's moving a lot in a direction right now. Elaine's sitting up here and has done a lot of that work in that space as well. But that's another area as well. And so you what? Health advocate. I mean, this is the thing. I mean, just the amount of work that is needed and needs to be done is unreal. I mean, and that's why we just got to keep going every day and just trying to do the best that we all can. And I can tell there's a room full of people in here that are out there advocating for themselves and others. So that's awesome. So, all right. Thank you all so much.
Thank you, guys.
Thanks.